PT with Frazier for the last 11 years. I graduated from the University of Evansville in 2006 and then started working for Frazier right after. So today is pretty informal. I want you guys to ask questions along the way if something comes up, but there'll be some time for questions at the end as well. Okay. So these are the objectives for our presentation today. We want to look at what the mechanism is for Parkinson's disease, look at what the current research shows is great medical management for Parkinson's disease, look at how PT and OT fit into the medical team, look at some common exercise routines for Parkinson's disease, as well as just look at general exercise principles that you might incorporate into other exercises as well. So, overview of Parkinson's. It's a neurodegenerative disorder that affects both motor and non-motor functions, and it's considered a disorder of the basal ganglia. In a recent study, there's approximately 1% of Americans who, over the age of 60, who are diagnosed with Parkinson's disease, and this equates to roughly 10 million people worldwide. And this prevalence is anticipated to double by the year 2030. The average age of diagnosis is 60, and 85% of cases are idiopathic with no known cause for the disorder. The severity of dopamine loss best correlates with motor symptoms of bradykinesia or slower movements or loss of movement. Weakness is not usually a primary deficit, and with the exception of poor musculature. There's also deficits with sensory integration, which affects movement plans, body orientation, and error detection capabilities. So these are some of the cardinal signs, and there may be a tremor, some rigidity, postural alignment may be affected. 80% of people will develop some festination or freezing of movement at some point, which we want to monitor and work on to reduce the risk of falls. There also may be trouble with like smaller handwriting or a lower amplitude of voice as well. So the medical, what the research shows currently is that medical management for Parkinson's disease needs to be multifactorial. Common pharmaceutical approaches include the use of dopamine replacement or dopamine agonists, inhibitors of dopamine metabolism, or anticholinergic agents. There's a lot of research out there about different surgical options, especially with deep brain stimulation. And this is something to discuss with your neurologist to see if you're a candidate or a loved one is a candidate for this intervention. And within the last 2 to 3 decades, there's been a lot of research on the effects of physical rehabilitation, and that's what we're primarily going to focus on today. So, physical therapy and occupational therapy, how does it play into management? So for physical therapy, the primary focus, and I'm a physical therapist by trade, so we're looking at mobility-related activity limitations. So physical capabilities, transfers, walking, balance, posture, core stabilization. Those are some things that as physical therapists we want to look at. Strengthening on level and unlevel surfaces to reduce risk of falling. The primary goal is to maximize movement quality and functional independence, as well as general fitness, while preventing secondary complications and optimizing safety. So, occupational therapy focuses on enabling a person's performance and engagement and activities related to the home environment like self-care or functional mobility, work, leisure activities, such as like going shopping or going out to the theater. In order to do these activities of daily living, what things need to be in place so that you can participate in not just a job as occupational therapy, but whatever recreational activities you want to do as well. PT and OT use education and coaching to empower an individual to work on self-management through exercise, practice, and compensatory strategies if needed. PTs and OTs strive to increase a patient's independence and reduce any caregiver burden if possible. And episodes of care are often needed throughout a patient's journey and lifespan. to recognize new problems and prevent decline. So oftentimes we don't see people every day or every week for a long period of time, but we may do short episodes of care as things change. Continuous exercise is necessary for most individuals, but specifically with individuals with Parkinson's. According to a systematic review by Robin Giesbert and Margaret Shankman, the research shows that patients with Parkinson's achieve a greater short-term improvements in gait and balance with physical therapy intervention than with a placebo or no physical therapy intervention at all. Because Parkinson's is a progressive condition, short-term benefits are important, but true benefits may only be realized by a patient developing the skills and strategies for long-term adherence to appropriate exercises and activities. Inactivity causes degeneration, and early treatment is important from a neuroprotective standpoint. So neuroprotective, like I said, exercises have been proven to have a neuroprotective property. If exercises are began early or during that dopamine degeneration, exercises reverse the motor symptoms and attenuated the loss of dopamine in the brain. So we think about from a neuroprotective standpoint, the term, it's use it or lose it. We want to make sure that you're using what you can so you don't lose it. There's also research out there that exercise is neurorestorative. If after more than 50% of the dopamine neurons are lost, exercise can reverse motor symptoms and increase the utilization of the dopamine that's still present. However, the intensity matters. Exercise should be designed to challenge the body. You may use resistance or intensity or duration to make it more challenging, and the intensity should be progressed as the body adapts to what it's given. So we think about from a neurorestorative program perspective, we want to use it and improve it. Okay, so intensive continuous exercise with optimal medications may slow motor deterioration and extend quality of life. In animal models of Parkinson's disease, stopping exercise canceled the brain and behavioral benefits that were gained by exercise. So we want to use it or lose it, but it needs to be continuous because inactivity is pro-degenerative. So again, that's inactivity is pro-degenerative. There's hope that with Parkinson's, intensive continuous exercise with optimal medications may slow the deterioration, okay? So back to that systematic review by Giesbert and Shankman, the results were obtained by a wide variety of interventions, including just general PT exercises, treadmill, dance, martial arts. So that research article showed that, among others, that exercises should be engaging, include a variety of exercises, and they need to be based on the individual's preference. It's not fun to go and exercise if you don't enjoy it. So thinking about finding something that's engaging and fun to do. So we're going to next go through some programs that are commonly used in our area here. There's a lot of research for each of these, and some of these principles are used in some of our Fraser clinics as well. These by no means are all encompassing because just as you just heard, the exercise benefits are not limited to specific exercises, but there's extensive research on these exercise programs for targeting specific things that are some of those common symptoms or cardinal signs that patients with Parkinson's commonly experience, such as postural instability, rigidity, or decreased amplitude of movement. So the first one is the LSVT BIG program. These principles are supported by research, and the protocols have been developed over the last 25 to 30 years, depending on which part of the LSVT we're talking about. So LSVT started in 1987. There is a speech therapist, Dr. Lorraine Remig, I might be butchering her name, but she met a patient, Mrs. Lee Silverman, and her family just talked about how they wanted to be able to hear her and understand her. And her children said the same thing. And this motivated Dr. Ramid to devote her life work to developing a program to increase amplitude of voice. And so the Lee Silverman voice treatment program was the start of the LSVT global training, and was later expanded into the physical therapy and occupational therapy program called the LSVT BIG program. The research on the LSVT BIG program is a little bit newer since it began with the LOUD program, but there are published randomized control studies that document improvements in the Unified Parkinson's Disease Rating Scale, which is kind of the gold standard scale which physicians use to measure progression of Parkinson's disease, as well as other tests of motor functioning. There are improvements in other tests of motor functioning as well. And these studies a lot of the research compares the LSVT BIG protocol to Nordic walking or just home exercises alone. Because of this research and the standardization of treatment, positive outcomes of LSVT BIG can be replicated around the world. It's a very standardized protocol, and patients, whenever you receive the LSVT BIG exercises, you know you're receiving the same thing that the research is based off as well. The intervention is performed by certified clinicians, and the treatment protocol is 4 times a week for 4 weeks, and they're an hour duration each time. There are 8 standardized exercises, which are a major component of the routine, but the rest of the exercises that you perform are specific to patient needs. So if an individual is having trouble rolling out of bed, that is something that you work on. Or if I've had patients that they want to get back to golfing, so we work on specific techniques to help get somebody back out on the golf course. It's individualized, as well as some exercises that everybody that does the BIG program also performs. The focus of the LSVT BIG program is on increasing an individual's amplitude of movement. The amplitude is the largest range of motion that can be performed with the highest effort and the most maximally efficient biomechanics. In order for the LSVT BIG program to be effective, every movement and every trial has to be performed with 100% amplitude. Now, one individual's amplitude or max amplitude may be a little bit different than another one's based on progression of disease or history, comorbidities, things like that. If somebody has a shoulder injury, that's obviously going to affect what their amplitude of movement is. But every person has to strive for that max amplitude every trial, every day, whenever those exercises are performed. And then also strive every day to make that amplitude even bigger the next time. And the goal of this is for sensory recalibration, to relearn what a normal amplitude movement is. And so a lot of our Fraser clinics have LSVT BIG certified therapists. And so if you go to the LSVT global website, you can search for certified clinicians to find one in your area. Power exercises are the next routine that a lot of people look into. And this stands for Parkinson's Wellness Recovery. And there's 4 basic moves that target skills that are known to deteriorate with patients who have Parkinson's. They can be practiced in multiple positions, and made progressively more physically challenging and cognitively challenging along the way. From their website, they talk about how these exercises mitigate the symptoms and rebuild functionality, no matter how they're incorporated into your life. They can be done as standalone exercises. I'll go ahead and flip over so you can kind of take a look at it. They can be done as standalone exercises, or incorporated into other exercise routines as well. Okay, the third one is Rock Steady Boxing, and I know I've heard some of you guys when as you were coming in talking about Rock Steady Boxing. So there has been significant research on this basically since 2006, and it's a non-contact boxing inspired fitness routine that drastically has shown improvements in people's quality of life. You can see there some of the workouts that are done. No boxing experience is necessary, and people of all ages are invited to participate. And my understanding is there's four levels of classes based on, and like the instructor will help place you in what level of boxing class you need to be in. And then the last one we'll talk about today is Tai Chi. And so Tai Chi is a 6,000-year-old exercise routine, and there's 108 intricate steps to it. There's a lot of research out there with it being such a long-standing exercise program. I pulled some of the research off of some systematic reviews that we'll go over, but if you go out there, there's a wealth of research over the last few decades. According to some researchers, Yu and his colleagues, he looked at 17 published randomized control trials that nearly had 1,000 subjects in it, 951 to be exact. Research showed that Tai Chi statistically improved the gait velocity, the Unified Parkinson's Disease Rating Scale, which we mentioned earlier, in the Berg Balance Score. There are benefits shown in the Brazilian Journal of Medical and Biological Research within the last few years. The National Parkinson's Foundation has made recommendations for using Tai Chi as a complementary therapy. And then a study by Lee and colleagues looked at comparing 80 minutes of Tai Chi 3 times a week for 2 months compared to 90 minutes of just a general exercise routine, same duration, 3 times a week for 2 months. And all of the participants were interviewed at the end of the study. And the results of that study looked at or showed improvements with timed up and go, walking speed, as well as functional reach had higher improvements compared to just the general exercise routine. So the take-home message of all of this is that common exercise routines that target some of those cardinal signs with rigidity or postural instability are very important, but again, any exercise is going to be better than inactivity. Exercise may also, like we talked about, look at reducing musculoskeletal rigidity. It reduces any secondary effects from immobility, can improve GI function, and also improve mood and energy levels. So next I just want to look at if no matter what you choose as your exercise routine, whether it be one of those ones that we talked about, or just say you really like cycling, or you really like to go swimming. Some things that to think about with whatever exercise routine you choose. So these are the 7 principles that we think about with choosing exercise and how to progress it. So individuality is just that that everybody is a little bit different. Just like what it says, that some people handle higher volumes of training while others respond to higher intensities. Their individuals' genetic abilities, predominance of muscle fibers, other factors, comorbidities, chronological age, or mental state all play into how you would choose an exercise routine. Specificity is that you can improve in order to improve your ability, you need to be very specific. So if you really want to work on rolling in bed, no matter like how much you cycle, that's not really going to help you get in and out of bed or up and down off the floor or whatever you choose unless you specifically practice that. If we think about athletes, a pitcher can work on their power and their muscular endurance, but they really have to focus on pitching in order to specifically improve that skill. And so making sure that you choose at least part of your exercise routine to be specific to your needs is important. Progression, in order to reach your peak ability, you have to start where you're at right now and progress up from there. And so if your goal was to climb 20 flights of stairs, you have to start with the first flight of stairs and then progressively climb from there. Overload is to increase your strength and endurance. You need to add new resistance and or time and intensity to your efforts. If you wanted to go out and you right now could walk a mile, you have to progress your distance up from there in order to get to where you could walk 5 miles. The same principle holds true for any strength or power exercises as well. Adaptation is that our body becomes accustomed to exercises at any given level. Where you're at right now, if you're walking a mile and you continue your exercise routine, your body's going to adapt, and a mile can be a warm-up down the road, and as you continue to increase your distance there. So you need to change your stimulus with either a higher intensity or a longer duration. Recovery is that our body needs rest and time to recover. And so short periods, sometimes people, based on where you're at right now, that might be waiting a couple hours. You have a morning session of exercises, you rest a few hours, and you do another round of exercises in the afternoon. Or if you have a specifically or a very intense workout, say you go to rock steady boxing or something like that, you might want to take a day to do a little less intensity of exercises to give your body time to rest and recover. But with that being said, some type of movement is needed daily. So it may not be an intense rock steady boxing exercise or something like that, but you still need to be moving and choosing some type of movement and exercise every day. And the last principle there is reversibility. Just that if you discontinue any particular exercise, you're going to lose the ability to successfully complete it. I currently am feeling this with my running of like, I haven't been running as much, so when I go out and I try to do a long walk or a run, then it's hard. So you gotta remember that the use it or lose it principles and use it and improve it principles that we talked about earlier. So some other considerations to think about for daily life. Most people will experience some type of fluctuation in functioning based on the changes in their dopaminergic medications. So if you may have heard those terms of on times and off times. So interventions that we think about or exercises that we think about trying to increase a person's physical capacity or learn new strategies are best recommended during those on times. If you're learning a new skill, you want to try to use or learn those exercises when medications are at their peak. That's going to be the easiest time to learn a new skill. But we also want to, when those skills are learned, focus on doing those exercises sometimes during an off cycle so that the difficulty is higher and you know you can still perform that exercise or that task during an off time to reduce complications or risk of falling. So considering on and off times throughout the day can be beneficial. Like we talked about, we want to increase amplitude. That can be done with resistance, time, duration, and external cueing can be beneficial as well. So having a loved one help you if they see that your amplitude of movement is smaller or they notice that you're talking quieter. Having someone tell you that is often very beneficial, and that can be more beneficial in a lot of cases than the use of a mirror. So doing exercises in front of a mirror doesn't show to have as big of an effect as if somebody's telling you move bigger or be like your left arm is not moving as big or something like that. Oftentimes people will use metronomes in music. That also has been shown to increase step length and speed as well. And so you might be thinking, when do I get help? It is never too early to begin an exercise routine. If you're currently not doing one, it's great to get started. And it's also important to remember that you and your loved ones are your best advocates. So if you go to see one of your medical providers and you think you want a physical therapy or occupational therapy referral, it's great to ask. So never think, just because they didn't mention it, doesn't mean that you wouldn't benefit from coming. So asking for a referral, and a lot of the research leans towards that episodic care that we mentioned earlier. Short bouts of therapy every so often can address new needs before a fall happens or before a skill is lost. Okay, there are some community classes. The YMCA has classes along with the National Parkinson's Institute. And so these are some websites to check out and look at what's going on in your area. And there's my contact information. I was going to see if Erica wanted to come up and mention some of the things with the National Parkinson's Foundation.
All right. My name's Erica. So it's definitely a joint effort between NPI and Fraser Rehab, so I want to say thank you. So myself and Eric, we run NPI. I see a lot of familiar faces. But we also coach rock steady boxing that Jessica mentioned down on River Road and at Masonic Homes. Also at Olmsted, which is also at Masonic Homes. And in addition to that, we also have a partnership with a nonprofit up in New Jersey, and we just, through that partnership, we also have access to a whole slew of brand new online classes, which incorporate a lot of those additional programs that she mentioned, like the Big and Loud, and a bunch of other alternative classes, which include more cardio, more core activation. I just want to encourage you guys to go to our website and really explore that. I don't know if I'm going to go back
to it, yeah.
Just because it's just a great resource, along with the YMCA, and there's so many resources online, along with our in-person options. So yeah, just want to thank you guys. And then if you do want to grab a flyer, we will be having 4 more along with this summer series. So definitely come back every Tuesday for the next 4 weeks. There's some great upcoming sessions that we'll be having. So, does anybody have any questions?
How does rock steady compare to physical therapy? I mean, Eric does so much with the guys, with people.
Eric does a lot. I think.
You both do.
Thank you. I think that there's components of both, and there's the only difference, and I'm sure there's a lot more than that I could add, is the intensity that you get with rock steady. And there's intensity in physical therapy as well, but the heart rate intensity, the boxing aspect is huge. Just those extras added in. And again, every rock steady boxing program is different. Ours is certainly unique. I don't know if every rock steady boxing throws in the therapy bases that we throw in. I know we have a lot of OT that we throw in, and there's some speech in there when we ask you guys to talk loud and call out what you're boxing, and then those extra PT aspects that we throw in. I don't know if every other program does that, but there's benefits that Jessica can speak to that PT has that we don't always focus on.
There's one great advantage that you have as well. It's the family atmosphere,
Yeah.
buddy fish,
Yeah.
working with other people who've got
Good
Parkinson's,
camaraderie.
and you all accept everybody's limitations and try and educate and help each other very much. This guy's my boxing buddy here.
That's for sure.
And I would just say say too, that they don't have to necessarily be mutually exclusive either.
Yeah,
Like if
absolutely.
there's something that, if you're going to rock steady boxing, but there's some aspect of your daily life that is not necessarily being addressed with rock steady, that may be where physical therapy comes in. So say you really have a specific need to come, that's coming up of like, yeah, that you want to work on. Or if during rock steady, if some of the instructors are like, oh, we're really noticing like something here, they may also recommend like a short bout of therapy or something
It's
like that.
more of like we work together as opposed of one, like the mutually exclusive, like one over the other. I think it's one of those things that we definitely have a partnership here as to if we, like she was saying, notice something that, hey, we need to pay attention to this more, maybe let's go to physical therapy and focus in on that. We work together.
And therapy is made for, like we said, those episodes of care. So rock steady it can be like your continuous, something that you continue on. It's something you're gonna plan into your daily life every week, ongoing. Therapy would be that short bout of I really need to work on getting up and down off the floor easier or something like
There's
that.
another thing as well, that you don't need a reference from a doctor to do rock steady
Yes.
boxing.
Yeah,
Well, I think a lot of people are put off by the idea that it's boxing.
yeah,
No, we need to educate people a bit more that it's a non-contact
yes.
type exercise. It's just there to build up
Yeah,
the
and
strength.
you're never boxing another individual. It's absolutely non-contact. If you are boxing with another individual, you're boxing mitts or a apparatus.
How long have you been doing rock steady?
Oh gosh.
I was started from day one with that, but I did it with
Wow.
another organisation before that, so I've been rock steady for about 5 years and I've been diagnosed for 7.5 years.
Yeah,
Yeah.
yeah, probably, maybe more, you know.
Yeah, we call him our rock steady boxing mayor.
Oh, yeah. That's your official title, huh? That's awesome.
Does
Well,
anybody else?
what I know is, about, we just do the class, at the Masonic Home and drive in from Spencer County, to do that. But what I appreciate is, you know, there's some aerobic element to it. There's that rhythmic with the boxing, but there's also things that really engage you mentally, and, you know, coordination,
Balance.
quick thinking, you know, trying to make decisions in some of the activities we do. I think I see all those as very beneficial.
I think the cognitive aspect is something that we really play into because it is so vital. It's definitely a very important, this is a neurological disease, so it's definitely something that needs to be hit, and we definitely strive to make it a point to hone in on that every single class.
I think that's important for anybody's exercise routine, is that it's not just focusing on one little thing. So I think that's wonderful that it engages everything. You guys are doing a good job.
Is anybody else?
With so many types of exercises, there's a recommended so many minutes a day or so many minutes a year, I mean, a week.
So
Is there any recommendation for Parkinson's people?
I would have to look up specifically for Parkinson's. What I would refer to right now is just the general exercise routines that, or exercise regimens that are recommended for everybody is 30 minutes a day of moderate exercise. So that's.
I think the big thing that the main thing that's important for Parkinson's is the amplitude or the intensity. It's one thing to just go on a walk, and if you were a part of just the general population that doesn't have a neurological condition, it doesn't need that intensity to really get the blood flow going and that intense part of I'm trying to get my words here. But I think the main point here is that for a Parkinson's patient, you really do need that intense aspect. So I think that's the main point that I'm trying to get to.
Yeah, like a leisurely stroll, you're not going to get as much out of it if you go out and even if you do a little shorter distance. Really focus on amplitude, big steps, big arm swings, you're gonna get more out of that, even if you don't go as far as what you did for a leisurely stroll. So really focusing on increasing amplitude. That's a very good point.
Anybody else? Alright, well, if anybody does have any questions or wants any more info on rock study, an address, or anything, just feel free to come up, ask questions. Again, I just want to thank you.
Thank you all, and thank you all for coming and